Thank you.
So you are Ness Olympic. How would you
Yes.
like to be addressed? Should I call you Miss Ness or Miss Olympic?
You can call me Ness.
So I am SIAPNO. I'm your pharmacist for today. Can you spare me some of your time so I can discuss your medication? Sure, how to use it? Rest assured, ma'am, that everything will be discussed with confidentiality and professionalism. Okay, let's get started. So, are you taking any prescriptions, medications lately? Non-prescriptions or any vitamins?
At the moment, I'm taking Benadryl for my allergy.
Oh, Benadryl, and that's an antihistamine. So what about herbal medicines? Do you take any?
I don't think so.
Do you smoke or drink? How frequent?
Well, I drink occasionally, but I do not smoke.
How about allergies? Do you have any allergies in foods or any crackers?
No.
May I just ask you, why do you think you are prescribed with this medication, afloxacin?
Well, I remember that it is for my ear infection.
Oh yes. So aside from that, do you have any concerns regarding the medication?
Not at all.
Okay, so Dr. Hazul has prescribed you with Inoflox. This medication is used to treat ocular infection, specifically in the ears. So the medication, it comes in OT form and we regularly administer it once a day. So do you see any problems with this medication?
Well, I tend to be forgetful. So what should I do with that?
So this medication, it is usually given once a day, right? And I suggest that you administer it after taking your lunch for you to remember. As for the administration, make sure that you have washed your hands thoroughly and you have cleaned the outer portions of your ear. And after that, you hold the container for 2 to 3 minutes to allow it to be warm. So the incidence of dizziness will be lessened. After doing so, you tilt your head and you apply the medication, 10 to 15 drops in both ears. Okay, may I just mention, this medication has a side effect and some people complain of having dizziness or lightheadedness. And since you're also taking Benadryl, which is for your allergy as you have mentioned, it can aggravate the incidence of dizziness. So I suggest that you take the medication separately. Okay?
Okay.
So would that be a suitable time for you, ma'am?
Yeah, I think so. I take it by 12 noon after eating my lunch.
Okay, so you should take it at the same time, okay? The usual length of treatment is commonly 3 weeks, but some patients, they take longer to heal. So if you still experience pain, you can come back at the pharmacy and we will see your progress. Alright. So aside from dizziness, may I just add, the side effects are diarrhea and vomiting. So if it happens, come. So for the schedule, since you have afloxacin to be taken after lunch, your Benadryl, you will take it at 10 p.m. to suit your schedule.
Okay, we'll take note of that.
Okay, ma'am. So, okay, be mindful of the side effects. Since it causes dizziness, you should not drive, okay?
Don't worry, I have my boyfriend to drive for me.
Okay, that's fine. As for the storage of this medication, avoid placing the container in excessive heated light as it may, decompose the active ingredients. So the expected outcome of this medication is obviously relief from your ear infection. And so once a day, you take it with or without food, and accompany it with lots of fluid. Could you state now your understanding of this session?
Okay, so first, afloxacin is being used as an antibiotic and it should be taken at 12 noon after having my lunch. And then Benadryl should be taken at 10 p.m. Side effects are dizziness, diarrhea, and vomiting. Is that right?
Yes.
Okay.
Okay, good. So, ma'am, here's my contact number. Just contact me when problem arises. So, I'm here Monday to Friday, 1 to 9 p.m. So, you can see me here. You can come to the pharmacy in 3 weeks of complaint. So, we can check.
Alright.
Thank you for your time, ma'am.
Thank you so much.
Please come again.
Alright, see you.